I'm going to present the update for the 25th of June 2021. A total of 4,350 results were received from the laboratories, and out of those, 2,428 tested positive for COVID-19, which represent a 56% positivity ratios. It's made up of 1,348 females and 1,080 males. The age range from 3 days to 101 years. They are as follow. Khomas 1,244 from Windhoek, to be followed by Omaheke with 201 from Hobabis, and then Erongo 2,000, made up of 123 from Swakopmund, 67 from Wos Bay, and 10 from Usakos. Kavango East 152 from Rundu, Hardap 136, made up as follow. Rehoboth 107, Mariental 24, Aranos 5. Oshana 101 from Oshakati. Karas 97, made up as follows. Ludaris 43, Kietmaswap 30, and Karasberg 24. Oshkoto 92, made up as follows. Onanjokwe 50, Sumed 36, Omthia 6. Ohangwena 85, with Enhana contributing 79, and Okongo 6. Omsati 71, with Otapi 48, Okahau 12, Sandi 10, and 1 from Oshikuku. Uchadojupa 36, with Okakarara having 13, Ushuwarongo 10, Grootfontein 8, and 5 from Okahanja. Kunene 10, 8 from Ucho and 2 from Opuo. Zambezi 2 from Katimavuriro, and Kavango East 1 from the Nahudu district. As can be seen, we have cases from all 14 regions. Khomas alone account for 51% of the total number of confirmed cases. There are 341 learners from different schools, 36 students from different institutions of higher learning, 32 healthcare workers, and 21 teachers. All these have tested positive and are among the 2,428 numbers which I have mentioned. Even though face-to-face teaching and learning has stopped, we still observe a high incidence of COVID-19 positive cases among learners. Of all the confirmed cases, only 28, which represent 1%, are recorded to have been vaccinated, mostly with the first dose. Only one among those was fully vaccinated with AstraZeneca. We have recorded 1,097 new recoveries. Although the number of new recoveries is quite impressive, it still falls short of the number of those who are newly infected. The recovery is as follow: Oshikoto 331, Kavango East 323, Oshana 203, Chobanjupa 124, Khomas 109, and Kavango East 7. We now have 18,985 active cases. This means that there is more pressure on isolation facility, more pressure on hospitalization, and more pressure on ICU beds. 528 of the positive cases are hospitalized, of which 81 are intensive care units. They are as follow: Khomas 262 with 50 in ICUs, Erongo 79 with 11 in ICUs, Oshana 54 with 16 in ICUs, Ochobanjupa 38 with 1 in ICU, Karas 24 with 1 in ICU, Hardap 17, Omaheke 15, Hangwena 8, Oshikoto 7 with 2 in ICU, Zambezi 7, Omsati and Kavango East 6 each, and Kunene 5. We announce 40 deaths, with Windhoek having 12, Oshakati 9, Swakopmund 6, Mariental 4, Okakarara 3, Okahao 2, Okahao 2, Oshikuku 2, Rehoboth 1, and Okahanja 1. Among those who have died, one person died at home. The rest of them died in hospitals. Only one person among the dead received the first dose of Sinopharm. The rest have not been vaccinated. In terms of vaccination statistics, so far 115,947 individuals received the first dose of the vaccine, and 23,075 have been fully vaccinated. In terms of summary, the cumulative number since the beginning of the pandemic is now 83,698, with 63,357 have been recovered, giving us a recovery rate of 76%. Total number of deaths due to COVID-19, 1,161, with 184 have been registered as COVID-19 related deaths, giving us a total of 1,345 deaths due to COVID-19. So far, a total of 513,983 samples have been tested. The number of those who are in quarantine facility is now 4,126. We are still recording many new infections, especially in Comas, where more than half of the new infection is recorded. We are called upon to exercise a high degree of self-policing and discipline. We must avoid gatherings of any sort, being it weddings, funerals, church events, house parties, celebration, and others. Let us stay in our homes and only leave when it is necessary. Only us can bring the pandemic under control.